Good evening, I'm Lee Anderson. St. Charles Health System is cutting back on the number of traveling nurses it puts under contract. A patient complained to us his surgery was canceled because of the cutbacks. Today, Blake Mayfield looked into the changes.
After employing over 150 traveling nurses early last year, St. Charles Health System is now down to 90. It's one way Central Oregon's largest private employer is dealing with rising expenses and flat revenue.
There are about 300 plus vacant nursing positions at St. Charles Bend alone. And so travelers play a key role in helping fill in that gap.
After hiring numerous traveling nurses under contract due to the pandemic, St. Charles Health System is cutting back.
We use nurse travelers to fill in, like when somebody goes on family leave or so a permanent staff is missing from the staffing mix, and so we hire or bring on a nurse traveler.
The development comes as a report released by Oregon hospitals say they finished 2022 in the red due to staff shortages, rising expenses, and stalled revenue. As part of their moves to stem the red ink, St. Charles is cutting back on employing higher-priced traveling nurses, bringing the numbers down to what they call a normal pre-pandemic level. Though the Oregon Nurses Association represents full-time staff, not the temporary contract workers, they don't welcome the news, saying it could make a tough situation worse.
We were already at a code red situation with nurse staffing at Bend, and losing more staff just puts us deeper in a hole.
Our vacancy rate for all of nursing is at 20%.
And while St. Charles is cutting back on hiring more travelers for now, they say plenty are still helping in critical sections of their 4 hospitals.
We currently have a 0 vacancy rate in our critical care nursing areas. So it's uneven level of vacancy across nursing, with the highest percentage in procedural and med-surg or acute care nursing.
A Bend man whose surgery was canceled recently says he was told by his doctor about the traveling nurse layoffs and that he'd be better off getting surgery elsewhere due to lack of bed space for his one-night stay. While rescheduling and even canceling of surgeries is not uncommon, the lack of staff and bed space is a concern.
And with St. Charles, we know they're already closing off beds because they don't have enough staff to care for patients.
If the surgery was canceled because we didn't have a bed available for the patient to recover, we work hard to prevent that.
St. Charles says pay disparity is not part of the reason it's cutting back on hiring travelers. But with Central Oregon's busiest tourism season now on the horizon, the health system will work to reshuffle staff in preparation for the summer. Blake Mayfield, News Channel 21.